So the question dens connatalis is synonym of neonatal teeth. What are neonatal teeth? The neonatal teeth are the teeth that erupts within the first month of life. The teeth that erupts within the first month of life are known as neonatal teeth, whereas the teeth that are present at birth are known as natal teeth. The natal teeth, they are more frequent than the neonatal teeth, the ratio being approximately 3:1. So, the natal teeth are more frequent than the neonatal teeth, the ratio being 3:1. What are the terminology and synonyms that we used for natal and neonatal teeth? They are congenital teeth, dentitia precox, fetal teeth, dens connatalis, infancy teeth, pre-deciduous teeth or precocious dentition. More than 90% of natal and neonatal teeth are prematurely erupted deciduous series of teeth. Only 1 to 10% of natal and neonatal teeth are the supernumerary teeth. According to Bodenhoff and Gorlin, the teeth most commonly affected are the mandibular incisors, that is 85%, whereas maxillary incisors are 11% involved. The natal teeth may be associated with cleft lip or palate. The cleft lip or palate can have a number of syndromes in which natal teeth have also been reported. Example are Paré-Robins syndrome, Mackay-Gruber syndrome. The factors that have been associated with increased risk of natal teeth are infection and febrile state, malnutrition, including hypovitaminosis, trauma, hormonal stimulation, or syphilis. What are the associated syndromes with the natal and neonatal teeth? They are Ellis-Van-Creveld syndrome, oculomandibulofacial syndrome, Soto syndrome, etc. Ectodermal dysplasia, craniofacial dysostosis, Van der Waals syndrome, Down syndrome, Walker-Warburg syndrome. So all these are important for MCQ point of view. What is the shape of natal or neonatal teeth? They can be normal in size, shape and color. Most of them, they are poorly developed, conical, small, hypoplastic, brown yellowish in color. What are the 4 clinical categories of natal teeth? They can be divided into category 1. Category 1 have shell-like crown structure, loosely attached by gum tissue with no root. Category 2 involves solid crown loosely attached by gum with little or no root. Category 3 means eruption of a cutting edge of crown through the gums tissue. And category 4 is swelling of the gums tissue with an unerupted but palpable tooth. What are the complications that may be associated to infant with this natal and neonatal teeth? There may be feeding difficulties, dehydration, malnutrition, trauma to the tip or ventral surface of tongue, that is known as Rega-Fede disease, that results in ulceration. So what is Rega-Fede disease? It is a mouth ulcer seen in infant and is usually caused by rubbing the tongue over the teeth. The ulcer may be uncomfortable, but it is otherwise harmless. What are the complications to mother related to breastfeeding? Painful, bitten or bleeding nipples. So what are the management of the natal and neonatal teeth? Conservative management is generally preferred. That includes grinding and smoothing the sharp edge of tooth, composite resin to form dome shaped over the edge of tooth so that the tongue glides over the tooth, changes in the feeding technique or dental hygiene including the fluoride application. Extraction can be performed with just topical anesthetic cream. Vitamin K injection should be performed before the tooth is extracted. The next question is, the critical pH for root surface demineralization is approximately. What is critical pH? The critical pH is the pH at which hydroxyapatite in the dental structure starts to dissolve. The normal pH of mouth is 6.2 to 7, whereas the critical pH for enamel demineralization is 4.5 to 5.5, whereas the critical pH for root demineralization is 6.6 to 6.7. So we see that root demineralize easier than the enamel. The root dentin vulnerable to acidic dissolution than the enamel because of its higher critical pH for demineralization than that of enamel. So the term critical pH, it is a dynamic number that depends upon the salivary calcium and phosphate levels. So when the pH drops below 5.5, there are insufficient salivary concentration of calcium and phosphorus. To counteract the process, enamel begins to lose its valuable calcium and phosphorus ions on the microscopic level. So as the hard tooth structure, they are repeatedly exposed to lower pH levels. What you see is the lower pH level for protected period of time, there will be a risk for both caries and erosion increase. Another important point that you have to remember is the critical pH for root surface is higher than the pH 6. So the critical pH for root demineralization is 6 to 6.7. So the answer here will be 6 to 6.7. So here is the question, identify the tooth anomaly. The anomaly here we can see is as similar as germination. So what is germination? Germination are the anomaly which arise from attempt at division of single tooth germ by an invagination with resultant incomplete formation of two teeth. So in germination, what we would say is a tooth that is separated from the crown portion. The structure here is usually one with the two completely or incompletely separated crowns. So these crowns, they have been separated, whereas the root is a single. So the structure here that could be seen is one or two completely or incompletely separated crowns that have single root and root canal. So germination, it is seen in deciduous as well as permanent dentition. The word twining has been sometimes used to design the production of equivalent structure by division, resulting in one normal and one supernumerary teeth. So when the one supernumerary teeth is there, then the term used is twinning. Now what is fusion? Fusion, as you can see, is fusion teeth arise through union of two normally separated tooth germ. The fusion, it can be complete or incomplete. So due to some physical force or pressure that produces the contact of developing teeth and their subsequent fusion. If this contact occurs early, before calcification begins, the tooth may be completely united to form a single large tooth. And if the contact occurs later, after calcification, then there will be union of the roots only. Are fused may have separate fused root canal, and the condition is common in deciduous as well as in the permanent dentition. The fusion, it is more common in deciduous than in permanent dentition. Another term is concrescence. Concrescence of the teeth is actually form of fusion which occurs after root formation has been completed. So in concrescence, the teeth are united by cementum only. The tooth would be united by cementum. So it occurs as result of traumatic injury or crowding. The concrescence is noted more frequently in the posterior and maxillary region. So in the fusion, you will see a single enlarged tooth or joint tooth in which the tooth count reveals a missing tooth when this tooth is counted as 1, whereas gemination, in which the tooth count would be normal when the anomalous tooth is counted as 1. So on tooth count in fusion, you will see a missing tooth when this anomalous tooth is counted as 1. Here is a question. The rationale behind hyperbaric oxygen therapy in case of osteomyelitis is mainly to increase the level of arterial and venous oxygen tension within the infected tissue. This is the line of the question. First of all, you should know is what is hyperbaric oxygen therapy. It is a treatment procedure that involves breathing 100% oxygen for certain time and under a certain pressure. As we all know that high concentration of oxygen, what it will do, it will enhance your body healing power. So it will enhance the body healing power to repair itself or to promote healing. So it will help to regenerate cells and tissue that are at risk of dying due to the diminished blood supply. The hyperbaric oxygen therapy, it promotes the wound healing. The hyperbaric oxygen therapy promotes the wound healing by number 1, it increases the blood flow. Second, it decreases the inflammation and swelling. Number 3, weakening the infection. Number 4, increasing the body ability to fight free. Number 3, increasing the body ability to fight free radicals. And stimulating the growth of new blood vessels, that is angiogenesis. Now, what you see is normally the oxygen that we breathe is delivered to the tissues and organs in the body by which cells? By the red blood cells. During hyperbaric oxygen therapy, there will be oxygen in the pressurized environment that will allow the oxygen to be dissolved directly into the blood plasma. So blood plasma, it is a liquid component of blood that will transport proteins, hormones and nutrients. As we all know that the plasma, it accounts for more than half of the body's total blood volume. So this plasma will carry the pure oxygen deep into the body tissue. Body tissue including the lymphatic system and cerebrospinal fluid that is surrounding the brain and spinal cord. So this results in much higher concentration of oxygen within the body. So with this highly concentrated oxygen via the plasma, that will boost the body natural ability to heal. The hyperbaric oxygen therapy has both bactericidal as well as bacteriostatic effect against both the anaerobic and principally anaerobic bacteria. And the third is hyperbaric oxygen, it potentiates wound healing by promoting fibroblast cells proliferation and endothelial cells angiogenesis. What is angiogenesis? It is stimulating the growth of new blood vessels. So out of these all options, all of them is correct. An enlarged and bulbous or club-shaped root is usually a sign of, it indicates hypersimatosis. Now what is hypersimatosis? Hypersimatosis, or the term used is segmental hyperplasia. It means that there will be excessive cementum. So there will be deposition of excessive cementum. And on radiograph, what would you see? In radiograph, you would see the affected tooth demonstrate a thickening of the root. In this figure, you can see this root is thickened. The enlarged root, it is surrounded by radiolucent periodontal ligament space and the intact lamina dura. Which tooth are more commonly affected in hypersimatosis? It's the mandibular molar that are affected most frequently, followed by mandibular and maxillary, second premolar, and mandibular, first premolar. Hypersimatosis occurs predominantly in adulthood, and the frequency that increases with the age. What are the factors that are associated with hypersimatosis? That could be either local factors or systemic factors. The local factor include when there is abnormal occlusal trauma, there could be hypersimatosis, or adjacent inflammation like pulpal, periapical, or periodontal involvement. The systemic factors, hypersimatosis may be associated with acromegaly, pituitary gigantism, arthritis, Paget's disease of bone. So if you get an MCQ, in which disease does hypersimatosis is seen? The answer would be Paget's disease, rheumatic fever, thyroid goiter, Gardner syndrome, or vitamin A deficiency. Now on histopathological examination, you will be able to see deposition of excessive amount of cementum over the original layer of the primary cementum. What is the treatment of hypersimatosis? It requires no treatment. A 14-year-old male show enlargement of tongue and lip, which is rapidly progressing as shown in pic below. OPG of patient is also shown. The probable diagnosis is, the answer is lymphangioma. So what are lymphangioma? Lymphangioma are the benign hamartomas tumor-like growth of lymphatic vesicles. These lymphatic malformations have marked prediction for the head and neck. About half of lesions are noted at birth, and around 90% develops by second year of age. So what is the characteristic features? The oral lymphatic malformations, they occur at various sites, but they are most common on the anterior 2/3 of the tongue, where they often result in macroglossia. So as similar as you can see in the pic. So the lesion here shown in the pic is a superficial in location and demonstrate a pebbly surface. So it has a pebbly surface that resembles a cluster of translucent vesicles. So this surface is just as similar as appearance of frog eggs or frog's pudding. Sometimes secondary hemorrhage into the lymphatic spaces that causes these vesicles to become purple. So what is the treatment of this lymphangioma? When required, treatment usually consists of either surgical excision or percutaneous sclerotherapy. So it has a pebble appearance, pebbly surface that resembles a cluster of translucent vesicles, just as appearance of frog eggs. that is characteristic feature of lymphangioma. The question: a 17 years old with inherited disorder is a tall, thin male who had a pneumothorax 2 months ago. On examination and on auscultation reveals that the chest is clear, but he has a clicking sound in his heart. He mostly has which of following disease? The answer would be Marfan syndrome. What is Marfan syndrome? Marfan syndrome, it is a heritable genetic disorder with autosomal dominant inheritance. The gene that is involved in Marfan syndrome is the fibrillin 1 gene, that is FBN1 gene. So this mutated FBN1 gene results in formation of defective or severe reduction in the amount of microfibrils, that is the essential component of elastic fibers and other tissue of extracellular matrix. What you would see is there will be musculoskeletal, cardiac and ocular problems that would predominate. Now the question here represent the patient is tall. So in Marfan syndrome, that is characteristic of musculoskeletal, cardiac and ocular defect that dominates. The shape of skull and face is characteristically long and narrow that commonly suggests the diagnosis of the disease. The patient has a long limb comparative to the trunk, as it is mentioned in the question. Other important feature of Marfan syndrome is the cardiovascular defect, as depicted in the question. The manifestation of this includes dilation of aorta with predisposition to rupture mitral and tricuspid valve prolapse, and there is enlargement of the proximal pulmonary artery. So all these features will represent the Marfan syndrome. Another important feature of Marfan syndrome is high arched palate. So on radiograph you would see like the skull radiograph that may demonstrate high arch palate, increased skull height and enlarged frontal sinuses. For the treatment, we need a strict multidisciplinary treatment approach that includes the cardiologist, orthopedist, ophthalmologist and psychiatrist. Malocclusion and high arched palate may require dental intervention that can be corrected by palatal expansion and orthodontic correction of the crowded teeth. Cope de Saber near the midline of face, contralateral Jacksonian epilepsy, trigeminal neuralgia and ocular findings are component of Romberg syndrome. Other name is progressive hemifacial atrophy, progressive facial hemiatrophy or Romberg syndrome. Now what is Romberg syndrome? It is a degenerative condition. It is a degenerative condition that is characterized by atrophic changes affecting the one side of face. So what you will see is the atrophic changes that are seen on the one side of the face. The onset of the syndrome is usually the first 2 decades. So there is atrophy of the skin and subcutaneous structure in the localized area of the face. The hypoplasia of the underlying bone may also occur. The most important feature is Cope de Saber. What is Cope de Saber? It is like a strike of sword, like a sharp line of demarcation that resembles a large linear scar between the normal and abnormal skin near the midline of forehead, also known as linear scleroderma. So it is just like a strike of the sword and a sharp line as a sharp line of demarcation that is seen in the midline of the forehead between the normal and the abnormal skin. Ocular involvement is common, and the most frequently ocular involvement is the inophthalmos because of the loss of periorbital fat. Trigeminal neuralgia may be seen occasionally, or epilepsy may develop. The mouth and the nose, they are deviated toward the affected side. Atrophy of upper lip may expose the maxillary teeth. So on microscopic examination, what you will see is skin that reveals the atrophy of the epidermis and infiltrate of lymphocytes and monocytes. The atrophy typically progresses slowly for 2 to 20 years and then it becomes stable. We can do plastic surgery that may be tried to improve the cosmetic deformity, or orthodontic therapy that might be given, and it might be helpful to treat any associated malocclusion. About the Mulkers and Rosenthal syndrome, it is a neurological disorder that is characterized by recurring facial paralysis, swelling of the lip and face, usually the upper lip, and development of fold and furrows in the tongue. Other is Beckwith-Wiedemann syndrome. It is condition that affect the many part of body. It is also classified as overgrowth syndrome. That means the affected infants are larger than the normal, that is macrosomia, and some may be taller than their peers during the childhood. And last is the Mishra syndrome or Mishra cheilitis. It consists of inflammatory disorder with known infectious and known necrotic granulomas, and appears as painless enlargement of lips with or without facial edema, producing both aesthetic and functional deformities. Rhabdomyosarcoma. So what is rhabdomyosarcoma? It is the malignant tumor of striated muscles. So they are the most common soft tissue sarcoma below the age of 15 years and rarely beyond the 45 years of age, and occurs in the female. There are 4 types of rhabdomyosarcomas: pleomorphic, alveolar, embryonal, and botryoidal. The most common type of rhabdomyosarcoma is the embryonal rhabdomyosarcoma. The subtype which is observed in children under the 15 years is the embryonal rhabdomyosarcoma. They occur more commonly in the head and neck area than any other form. They arise from orbital, facial, and cervical musculature. Second is the botryoidal rhabdomyosarcoma. It is accepted as variant of embryonal rhabdomyosarcoma. It has been reported involving the maxillary sinus, nasopharynx, etc. Third is the alveolar rhabdomyosarcoma. They occur much earlier in life, generally between age 10 and 20 years. Last is the least common out of all is pleomorphic rhabdomyosarcoma. Now coming to the question, the racket type of racket cells are most commonly seen in. The characteristic feature of rhabdomyosarcoma is large, bizarre cell. The nuclei, they are situated often in an expanded end of cell, that is the racket cells. The strap and ribbon cells show property of long streaming cytoplasm. So they mostly consist of spindle cells that are arranged in the haphazard arrangement. They are generally large and show variation in appearance. The nuclei, they are ovoid or elongated or pegged chromatin. The characteristic feature of this form of tumor is the large bizarre cells. The nuclei that are situated in the expanded end of cells, The Rechet cells. Strap and ribbon cells show the presence of long streaming cytoplasm. So your answer will be rhabdomyosarcoma. Another question is, which of the following is not true of the trigeminal nerve? The first option is severe paroxysmal pain. So what is trigeminal neuralgia? First of all, you should know that the trigeminal neuralgia, the condition that may be caused due to the blood vessel, they are pressing against the trigeminal nerve. So that is why it is known as vascular compression. So what does the trigeminal neuralgia pain feel like? The main symptom of this trigeminal neuralgia is sudden attack of severe sharp shooting pain that lasts for a few seconds to about 2 minutes. The pain that you will feel is like as similar as the electric shock on the one side of face, like someone has given you electric shock on the one side of the face. So this chronic pain will affect the trigeminal nerve that will carry the sensation from your face to your brain. So there is paroxysmal extreme pain disorder. So what does the paroxysmal word means? It is condition that is characterized by skin redness and flushing and attack of severe pain in the part of the body. Have you ever thought, why do the skin flushing appears in case of trigeminal neuralgia? This happens because of the increased blood flow. So the pain is excruciating like an electric shock. The attack can be so severe that you are unable to do anything while they are happening. The trigeminal neuralgia is unilateral location, that it is more common on the right side than on the left. That hold correct answer for the B option. So the B option is correct. The pain is unilateral. It involves the right side more commonly than the left side. The V2 and V3 dermatomes are mostly affected. The trigger zones that are present mostly in the V2 and V3 dermatomes. Remember, there is no evidence of neurological defect. So there will be no neurological defect. So option D is incorrect. There will be frequent lip pain, and you will find that the local anesthesia that could be given, that will temporarily arrest the pain. So the most common cutaneous trigger zones that will be involving the corner of the lip, cheek, ala of the nose, or the lateral brow. Intraoral trigger zones that could be affected are the you will see the teeth, gingiva, or the tongue. Now what are these trigger zones? The trigger zones, these are the area where the mechanical stimuli such as soft touch may provoke an attack. A patient upper central incisor, the mesial and distal surface of crown is tapering and converging toward the incisal edge of tooth, rather toward the cervical margin, and incisal edge is notched. The mandibulus central and lateral incisors are similarly involved. The patient is suffering from congenital syphilis. So it is a common pattern of presentation for the congenital syphilis and consists of 3 phenomena, that is also known as Hutchinson triad. Hutchinson triad means there will be involvement of 3 structures. Number 1, ear, number 2, eyes, and number 3, teeth. If the ears are involved, you will see 8th nerve deafness. If the eyes are involved, then you will see interstitial keratosis. So what is interstitial keratosis? It is a serious condition in which blood vessels grow into the cornea. So such growth can cause loss of normal clearance of cornea. This condition is often caused by the infections. And last, when the teeth are involved, then you will see mulberry molars and notched incisors. So the syphilis you will see Hutchinson triad that consists of three features. Number one is interstitial keratosis, second is eighth nerve deafness, and third is Mulberry molar or notched incisors. The anterior teeth are known as Hutchinson teeth, while the molars they are referred as Mulberry molars or moon molars or Fournier molars. Now coming to the question, in congenital syphilis you will see the upper central incisor that is screwdriver shaped. What shaped? At a shape like that of a screwdriver. The mesial as well as distal surface of crown they are tapering and converging toward the incisal edge of the crown rather than the cervical margin. And also the incisal edge you will see that it will be notched. The mandibular, central and lateral incisors may be similarly involved, but the maxillary lateral incisor that may be normal. So that is known as Hutchinson teeth. And coming to the Mulberry molars, the crown of the first molars are irregular, and the enamel of the occlusal surface and occlusal third of the tooth appears to be arranged in the mass of globules rather than in well-formed cusp. So you will see the enamel that will be in form of globules rather than in form of well-formed cusp. The crown will be narrower on the occlusal surface than at the cervical margin. So these all are characteristic feature of congenital syphilis. That is what you have to remember for this MCQ question. Now here is the question, identify the condition. So this is benign mucous membrane pemphigoid or the cicatricial pemphigoid. So what is this disease? It is an autoimmune blistering disease. So what you can see here is blister formation that will affect the mucous membrane. So it is a blistering disease that is associated with the autoantibodies that are directed against the basement membrane. What you will see in the oral manifestation here you can see is the mucosal lesions. They are affecting the gingiva. They are vesiculobulous in nature. You can see there is raw, eroded and bleeding surface. So this is the characteristic feature of the cicatricial pemphigoid. The most consistent oral lesion that can involve is the gingiva. So it is generally vesiculobulous in nature, thick walled, and that is why it can persist for 24 to 48 hours before rupturing and desquamating. So what you will see is before their rupture they leave a raw, eroded and bleeding surface. That is what you can see here. So your answer will be cicatricial pemphigoid. The type of caries that occur on the occlusal surface of teeth or buccal and the lingual grooves of posterior teeth is known as pit and fissure caries. So this figure you can see is example of pit and fissure caries. It is seen on the occlusal surface. The pit and fissure of the occlusal surface of the posterior teeth are more prone to caries development due to their morphological complexity, as they have grooves and pits along with them. So that will make the dental hygiene more challenging, leading to the smooth surface caries. The smooth surface caries occur when there is no pit, groove or any other fault on the tooth. It occurs in area where the bacteria plaque collects, such as between the teeth, along the gum lines, etc. The root caries that occurs on the root surface is the root caries,
And option D is the secondary caries. Secondary caries, there are two types of caries. One is the primary caries that include caries that appear in the teeth without restoration, and the secondary caries are defined as lesion on the border of restored teeth. Secondary caries is a disease that occurs on the tooth after filling has been used for a period of time.
A burning mouth syndrome that may be associated with. As we discussed that the burning mouth syndrome, it has both local cause and systemic cause. Now, what are the local causes that are associated with the burning mouth syndrome? The local causes that could be associated are: number one is the dry mouth, that is the xerostomia, or there could be reflex such as GERD. So, in both of the situation, we can see burning mouth syndrome. From the burning mouth from the acid reflex is that is a type of secondary burning mouth syndrome. Other etiological causes could be mucosal disorders like geographic tongue, trauma to the oral mucosa, that could be either due to the poorly fitting dentures or any sensory nerve damage, either due to trauma or some repetitive oral habits like tongue thrusting or GERD reflex. Whereas the systemic medical causes that could be due to the vitamin B12, folate or iron deficiency, use of medications like ACE inhibitors like captopril, allergic reactions, immunological mediated disorders like Sjogren syndrome, psychogenic disorders like depression, anxiety, fear of cancer, other conditions like diabetes mellitus or menopause conditions. So the answer here will be both of above. The burning mouth syndrome that may be associated with, it could be associated with any of the above, either acid reflux from the lower tract, that is due to the GERD, or due to the dry mouth. Let us discuss the various terminology regarding the tongue. The first terminology is the glossodynia. What is glossodynia? It is referred to as a painful tongue. The term glossodynia means the painful tongue. Another terminology is glossopyrosis. What is glossopyrosis? Glossopyrosis is the term that is used for the burning tongue. So it is as similar to as the burning mouth syndrome. So the other name of burning mouth syndrome is glossopyrosis, that is the burning tongue. Now third etiology is glossoptosis. What is glossoptosis? It refers to the incorrect placement or displacement of the tongue. So at birth you will find that your infant tongue that is farther back in their mouth than it should be. So this position can block your child airway, affecting their ability to breathe, eat and swallow. Name the condition where you will find glossoptosis. It is the Pierre-Robin syndrome. So what is Pierre-Robin syndrome? It is a congenital birth defect that is characterized by underdeveloped jaw, backward placement of the tongue and upper airway obstruction. Another terminology that could be used is odynophagia, is a disorder in which swallowing feels painful. Odynophagia means painful swelling.